Hey there, you're welcome to PPIs Care channel, where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos and contents here on our YouTube channel. Also, you'll be able to help support our community here at PPIs Care. So what is our topic of choice today? Our topic of choice today is H-Pylori. So you've probably heard of H-Pylori when going to your doctor regarding maybe a stomach side effect, the stomach symptoms that you're getting. Doctors may choose to check for that lab to make sure that you don't have any ulcer-related, H-Pylori going on, to make sure that, you don't have that bacteria actively present in your gut area that is causing those stomach side effects. So what is H-Pylori? So H-Pylori is a bacteria that colonizes the gut, and it produces three major enzymes known as urease, catalase, as well as oxidase. So the catalase helps it survive in the stomach area. So this is what actually helps it, thrive in that acidic stomach environment. So the bacteria kind of increases risk for chronic swelling in the stomach. So patients will usually get those symptoms due to that chronic swelling and due to that production of those enzymes that the bacteria is producing in the stomach area. So what causes H-Pylori? So why do people get H-Pylori? So H-Pylori can be caused by being in contact with someone else who has H-Pylori, either through, they're being in contact with their vomit or being in contact with their diarrhea. So maybe being in contact with their stool. These patients may, actually contaminate foods or other individual as well when it comes to H-Pylori. So testing is usually done usually in patients who have an active peptic ulcer disease, patient who have a past history of peptic ulcer disease, as well as patient who have a history of something they call gastric mucosa associated lymphoid tissue lymphoma, or patients who have a history of endoscopic resection of gastric cancer. So usually in those patients, they will do a H-Pylori test on them. So how do they test for H-Pylori? So H-Pylori is tested using first a urease breath test. So the urease breath test is basically placed in the patient's mouth, and they're allowed to breathe on the test. And they kind of test to see if that whatever they breathe into that urease breath test contains H-Pylori. Also, the breath test kind of tests for if there's a large amount of urease. Like I said, the H-Pylori produces urease in the gut. So they can also do a stool antigen test. So they take some part of the stool and they pretty much test to see if there's any H-Pylori present. Also, they can do a blood test, which kind of help test to see if there's any antibodies in the patient that's, helping the patient, that's kind of, developed in order to help the patient treat H-Pylori naturally. Or they can do an endoscopy, which is usually the very last line of what they do when it comes to testing for H-Pylori. So if H-Pylori is left untreated, it can cause peptic ulcer disease. It can also cause that mucosa-associated lymphoid tissue lymphoma that I mentioned earlier, as well as cause gastric cancer in patients. So how do you prevent H-Pylori? So H-Pylori can be prevented by making sure you're using good hand hygiene, making sure that you're reducing any psychological stress, making sure that you're also not smoking. So make sure that you're stopping cigarette smoking, as well as avoiding food or beverages that's going to increase that stomach side effect to when patients do have H-Pylori. So these are how to kind of prevent those flare-ups in those patients. So for our patients that are being treated with or for H-Pylori. So how are patients treated for H-Pylori? So patients are usually treated using the main course of treatment, or the main reason why this is treated, is to kill that bacteria. So the aim is to kill that bacteria that's causing that stomach symptoms, which is H. pylori. So usually we use a 3 triple therapy in those patients. So we'll use a medication class called a PPI. So a PPI will be like your omeprazole, your lansoprazole, pantoprazole. So these are all known as proton pump inhibitors, which are your PPIs. So usually, commonly, they would prescribe pantoprazole because that's usually the medication of choice. And they will add that onto an antibiotic called clarithromycin, and then they will add on an amoxicillin. And all 3 are usually taken twice a day. So usually they'll use pantoprazole because you can take that with or without food. You don't have to take it on an empty stomach. So they would use that twice a day for about 14 days. So patients will use that combination of 3 medication twice a day, like I said, for 14 days. It also comes in like a combination pack, which is called Prev Pack. Prev Pack is known as, it contains Prevacid rather than pantoprazole. So Prevacid is the generic for Prevacid is lansoprazole. So patients will have to take that for 14 days, as I said earlier. Also, patient can opt for, instead of our patients who have like an allergy to penicillin, rather than doing the amoxicillin, they would do a Flagyl or metronidazole in those patients twice a day. So it would be a PPI, which could be, like I said, the pantoprazole, lansoprazole, omeprazole, plus a clarithromycin antibiotic, plus a Flagyl. So like I said, those are usually taken twice a day as well. And patients will have to take that for 14 days. So let's say, for instance, the patient is allergic to clarithromycin and they can't take, let's see, amoxicillin. So there's something called, or there's a therapy called a quadruple therapy. So for the quadruple therapy, patients would take a bismuth, they would take a Flagyl, they would take tetracycline, as well as a PPI. And they would take those, they would take the bismuth, the tetracycline, as well as the Flagyl 4 times a day, and then they will have to take the PPI twice a day. And usually for that therapy is about 10 to 14 days. So these therapies are usually very effective in treating the H. pylori. They don't need to be extended for a longer period of time, more than 14 days. That should pretty much help, and the doctor might end up doing like a repeat test to make sure that the H. pylori has been, you know, the bacteria has been killed off after you're done with the medication. That way, you know, they can rule out any H. pylori that's going on. So that's pretty